My name's Melissa Foley. The reason I decided I wanted to become a chiropractor was because I really wanted to work within the sort of healthcare profession, but I wasn't so keen on working within the NHS with the restrictions that tend to surround that. So the more I sort of started to sort of look into it and research into it and then start studying, I just really fell in love with the profession, and it has turned out to be more than just a job to me, really. Chiropractic adjustments or spinal manipulation can be dated back thousands and thousands of years to the sort of ancient Greek and Chinese civilizations. The 20th century saw the profession grow massively within sort of healthcare, and it gained respect and recognition throughout those years, much of which was underpinned by research from within and outside chiropractic communities. And today it's fully regulated in the UK, and we are respected within the primary healthcare. Initially, patients do tend to come to see us because they are in pain or discomfort, or they can't perform certain activities that they're used to, or they're finding some daily activities difficult. So that tends to be how people initially come to see us, and we work at correcting those initial problems by finding out where the pain's coming from and other areas that can potentially be irritated by that. Following that, we do very much recommend that patients come and see us on a sort of maintenance basis, very similar to when you go to see your dentist, really, to help maintain the improvements and basically prevent any reoccurrence of the problem again. Basically, the most common problem will be back pain. I think it's because most people's problems do tend to sort of focus in the back or the neck. Because of the tissues and structures in those areas, they are quite pain sensitive. However, what we tend to do is look at the body as a whole, so we don't just look at the area of pain, because quite commonly, unless there's a very significant or specific trauma to that area, quite commonly other areas are either causing that area to become painful or they're having an effect because of the pain. So we'll look at an individual as a whole, make sure there aren't any other areas that are sort of adding to this pain, and we'll basically treat any areas we find that are causing a problem, and others that we potentially think can be caused or can create tension and discomfort because of the pain. We'd also give advice on activities and sports that people can do at home, or if they're already doing those, how they can improve them and prevent the injury reoccurring. We also give advice on rehab and just general lifestyle factors such as diet, supplements and things like that that can also help to maintain that level of improvement and basically optimise their health. The treatment times last about 15 minutes, give or take 5 minutes. I think what tends to happen is we see the patient more consistently to begin with, and then we spread treatment out. Ultimately, if there aren't any complications or problems that are unforeseen, treatment will tend to take about 4 to 6 weeks for that injury to heal. That's just how long the body tissues take to respond and start healing from any kind of injury, whether you've had a trauma or it's been a problem that's been going on for a very long time. It's very difficult to say right at the beginning, before we've started treating you, how quickly you'll respond, because everyone does respond at different rates. Once you get to the end of that period, when your pain and discomfort have alleviated and you haven't got any signs and symptoms of any weakness, what we then tend to do is recommend the maintenance. So come and see us every 6 to 8 weeks, 2 to 3 months, to make sure that problem doesn't drop back down again, particularly if it is related to posture and activities of your daily life. That, sitting at a desk, for example, you need to do that for your job. If that tends to be the aggravating factor, it is always good to keep on top of things so you don't drop yourself back into that area of discomfort.